My name is Megan Nayrad, and I'm a research fellow working with Dr. Sherry Wade here at Cincinnati Children's Hospital in Cincinnati, Ohio. Dr. Wade has prospectively followed a cohort of children who sustained a moderate to severe traumatic brain injury between the ages of 3 and 7 years of age. The most recent data collection for this study occurred as the children were transitioning to middle school approximately 7 years after injury. Today I'm going to talk about a study we completed examining the rates of need for academic support or service, academic service utilization, and unmet need for academic support within this population. We also examined a number of factors potentially associated with academic service utilization, the needed school services. The present study aimed to fill this gap by examining the prevalence of need for academic support, receipt of academic services, and the rate of unmet need in this cohort 7 years after early traumatic brain injury. We also evaluated a number of factors that we thought would be associated with the receipt of academic services as well as the unmet need for academic service within the school setting. We hope that the information would possibly lead to avenues for better understanding and addressing the long-term academic difficulties within this population. Participants at this long-term follow-up included 130 adolescents who were hospitalized overnight for a traumatic brain injury or an orthopedic injury between the ages of 3 and 7 years of age. Our sample, which was collected approximately 7 years after injury, included 58 adolescents with a history of traumatic brain injury. This included 14 with moderate injuries, 16 with severe injuries, and 28 with complicated mild injuries, as well as 72 adolescents with a history of orthopedic injuries. We categorized our injury severity based on the Glasgow Coma Scale. Those with severe injuries had a GCS of less than 8. Moderate injuries were defined as a GCS between 8 and 12, and complicated mild injuries included children with a GCS of greater than 12, accompanied by clinically significant imaging findings. The orthopedic injury group was our comparison group to control for factors associated with significant early childhood injury, as well as family stressors and burdens that could be associated with having a child hospitalized for a severe injury. We determined if a participant had a potential need for academic service if they had a full scale IQ of 80 or less, a standard score of 80 or less or on any of our academic achievement measures, parent-reported behavioral or executive functioning concerns, teacher-reported behavioral or executive functioning concerns, or parent-reported diagnosis of attention deficit hyperactivity disorder, learning disability, or developmental delay. Our findings suggested that students with moderate and severe traumatic brain injury had significantly greater rates of need based on our definition than those with orthopedic injuries. It was determined that a participant was receiving academic services if their parent or teacher reported that they were receiving IEP or 504 services at the time of the visit or any other special instruction or support within the school setting. Our findings showed that when service utilization was examined within the entire sample, a greater proportion of those with severe brain injuries were receiving academic services than those with orthopedic injuries or those within the complicated mild group. However, when we looked at service utilization among the group with an identified need, injury severity did not affect service utilization. We then used logistic regression to explore which areas of need were predictive of academic service utilization, and findings suggested that only IQ and achievement need was associated with service utilization, such that those with an identified IQ or achievement need were more likely to be receiving academic services. Next, we defined unmet need as the presence of a need for academic services without the accompanied report of receipt of academic services. And what we discovered was that rates of unmet need were high and similar across injury groups, ranging from 46.2% to 63.6% across the 4 injury groups. Further, need based on parent or teacher report of behavioral or executive concerns were more likely to be unmet than need based on IQ or achievement performance or previous diagnoses. Our findings show that among adolescents who sustained an early traumatic brain injury, the need for academic services remains high even years after injury. Further, they demonstrate the importance of continued monitoring of behavioral functioning that may impact success within the school setting as well as academic performance among these students. And this might be especially true among students who sustained less severe injuries, as they seem to be the group most at risk for being underserved. And this may arise as parents and school professionals may view their child as recovered from these less severe injuries years after they have sustained the injury. And while they may have recovered significantly in a variety of domains, they may also continue to experience prolonged deficits in areas required for continued academic achievement and advancement, such as executive functioning and having difficulty meeting the more complex demand required of them as they progress through the school setting.